I am so excited to bring on today's guest, which is Dr. Amanda Olson, who is a physical therapist that specializes in treatment of pelvic floor disorders. Her area of expertise includes urinary and bowel incontinence, pelvic organ prolapse, pelvic pain, pre- and postpartum issues, endometriosis, MRKH, AIS, pelvic implications in runners, and oncology-related issues. Dr. Olson holds her doctorate in physical therapy from Regis University and has since accumulated extensive and diverse clinical experience. She holds advanced certifications as a pelvic floor practitioner from the American Physical Therapy Association and the Herman and Wallace Pelvic Institute. She has a number of publications that can be seen in the British Journal of Sports Medicine and the Journal of Women's Health Physical Therapy. As the president and chief clinical officer at Intimate Rose, Dr. Olson is committed to enhancing global health. The mission of Intimate Rose is to provide exceptional care and quality products for women, ensuring their health and well-being. The compassionate and skilled team at Intimate Rose delivers unparalleled services, leading to life-changing results for their patients. Today, we're going to dive into pelvic pain and figuring out if you are somebody who would benefit from Intimate Rose tools or potentially benefit from working with a pelvic floor PT. Welcome to the Dangerous Women podcast, where the intersection of fierceness and femininity fuels empowerment. Our goal is to provide women with insights to unleash their power. Grounded in the 7 principles of self-confidence, we guide women to embrace their duality, delicate as a flower, yet powerful as a bomb. I'm your host, Colleen Conlon, inviting you to join me as we explore topics on health and wellness, empowering you to embody the essence of your dangerous woman. So, Amanda, what are some of the symptoms that would be considered pelvic pain?
People generally report a number of different types of symptoms that can reflect pelvic pain, and that might include a dull ache sensation anywhere in their pelvis, including their groin, or maybe in their vaginal canal, or maybe near their tailbone or their rectum. They may also report a burning or zinging sensation. Those often reflect like a nerve type pain, where perhaps there's some compression on the nerve is irritated, maybe due to inflammation, those kinds of things. And then additionally, it may be pain during certain activities only. So it may be neuromuscular or musculoskeletal driven during a certain activity, like perhaps during like a kettlebell swing, or maybe it's during intercourse, or when they go to wipe or something like that in the bathroom. Those are all different types of symptoms that may be driven by pelvic floor dysfunction and are reflective of pelvic pain.
So it sounds like it could be really diverse. It's not just like it's one thing constitutes as this is pelvic floor pain.
Exactly. Yes, because there can be different structures driving that pain. So it could be the burning, the zinging, the dull ache. Some people describe it as like a headache in the pelvis. There's an actual
Ooh.
book titled that entire thing, but it's just kind of this throb sensation.
And is there ever a time that it's normal to have pain in the pelvic floor?
Not normal. No, pain is generally a sign that your body is trying to tell you something needs your attention. It doesn't necessarily mean it's an emergency, although there can be emergencies that occur that our pelvic pain would be a symptom of. But it is a sign that something is not coordinated or working as it should be. And the good news is that pelvic pain is fixable. It is totally manageable. You don't have to live like that. It doesn't need to just be part of your everyday. You don't need to just automatically stop doing this one thing, but it may take some time to address the driver and to retrain the tissue and retrain the muscles in order to get it alleviated.
I love that you say that. And I love that you say that there are solutions. You do not need to be in pain. It is not normal. I spent so much of my life in pain, just thinking like, this is just life. I have to deal with it. And finally figuring out what was causing the pain and treating it really did changed my life, and using your products on the regular has definitely been part of that managing of pain for myself. So I'm just so grateful that we have you on the show today to dive into all of this. Can you talk about the different types of things that could be causing pelvic pain?
Sure. I mean, looking first at what we call red flags in healthcare, and these are things that if you are experiencing pelvic pain, we do recommend making a visit with your primary care physician or your gynecologist to make sure that there's nothing serious at hand. Because certainly, and they are more rare, but certainly it could be that you do have cancer or there is an ectopic pregnancy or something that is creating a more emergent or urgent healthcare situation and is a product of that pain. So we always want you to go see your physician if you're experiencing pressure or that zinging pain sensation or that dullness and aching. From there, it's really important to know that if your physician works you up, does the ultrasound imaging or the MRI or the blood work and all of that, and it all comes back clean, you're not crazy. It's not all in your head because muscle dysfunction can be driving and causing pelvic pain, and it's not going to show up on a blood test or an ultrasound image or an MRI. And that's where we in pelvic therapy do a really thorough evaluation of you to determine what that driver is, because it could be that the pelvic floor muscles are contracting or tense, and there's some tender points in there, just the same way where you'd get a knot in your shoulder, your neck, and you push on it and it zings up and over your head and it feels really painful. That's something that a muscle can do, and the pelvic floor muscles are no different. They are muscles just like everywhere else. So having those tender points can be a driver of pain. The pelvic floor muscles contracting when they should be relaxing can drive pain. Examples of that are when we go to urinate or have a bowel movement, the pelvic floor muscles in that case need to drop and expand and relax in order to allow those things to pass through. Also during penetration, whether it's tampon, speculum, or during intimacy, the pelvic floor muscles should be in a relaxed state instead of clenched and guarding. But if they are clenched and guarding when something's trying to enter, that can absolutely drive pain and also frustration because mechanically things are not working and happening as they should. So, and then also just scar tissue and restrictions. So, having had surgeries, like if you've had your appendix removed or a laparoscopic procedure or a gynecologic procedure, sometimes there can be scar tissue left over afterwards that can create restrictions in the tissue. And then you go to move a certain way and it's pulling against it. And the good news, again, that's also treatable. Some people will say, well, this scar is many, many years old. I'm sure there's nothing you can do. Oh, no, we can soften that scar. We can get it to move better, whether it's on the inside of your body or in your abdomen or anywhere else. There's a lot of good that can be done.
So this all can be caused from a surgery. It can be caused just, can you just be born with a tight pelvic floor or pelvic floor dysfunction?
Usually people are not born with it, but they may start to develop a habit of clenching
Mm.
it at a very early age. Interestingly enough,
Mm.
if people are potty trained under very strict
You're
paradigms,
kidding.
I know it's really tough. And this is where childhood can have a direct result on our pelvic floor behaviors. If there's a lot of shame or if there's very strict rules around potty training, there can be withholding. Or if as a child you had a fear of the potty or having a bowel movement and you were clenching your little 3-year-old pelvic floor muscles and your brain started to learn that response, you may have chronic constipation, which is a whole nother set of issues, also treatable with pelvic floor coordination and training and therapy. But those habits are long standing and they can result in the muscles being very short. It would be almost as if you were walking around with your shoulders shoved up into your ears, like as a stress response all day long. And you can imagine then that the muscles would be very short and very tight and super sore.
Wow. Okay. So if you're saying this can happen in that developmental stage of potty training, if we have other stressful situations going on throughout our life, teen years, adult years, could that also be causing us to tighten up pelvic floor muscles and having dysfunction because of it?
Absolutely. So during times of stress, during times of trauma or abuse, whatever the trauma was, whatever the type of abuse it is. The pelvic floor muscles have wiring deep within our brains to contract and protect us during a time of threat. Interestingly enough, we've seen this in an MRI study. What they did is they put women into an MRI and they were monitoring brain activity and pelvic floor activity, and they showed a violent image. It was a movie, and they monitored the response. And even non-symptomatic women tightened and contracted the pelvic floor, visually seeing this thing happen in front of them, even though it wasn't happening to them, and they were safe in this MRI machine. So it's this very deep-rooted response where our pelvic floor muscles want to protect the genitalia, want to protect the tail. You observe this in animals if they've been threatened or hurt or hit or things like that. They get scared. That tail wraps under. Pelvic floor muscles in an animal creates that tucking maneuver to pull that tail down. And we as humans exhibit the same thing. So certainly those habits can also maintain, and especially if the trauma and abuse maintains for prolonged periods of time. But interestingly enough, it can take one instance of that guarding and it never quite comes down. And that's where this interrelationship between our brain and our body is merged. It is just simply merged, and we have to help manage both, oftentimes, in order to undo the one.
You just like my mind feels a little bit blown right now. It's incredible to see how much of a psychological, how much the mind and the body are interconnected for somebody who might be having pelvic floor pain. And can I ask you, I don't know if there's a statistic to back this up, how many people go through some part of their life with pelvic floor pain?
The statistics are showing that at least 1 in 3 are going to have some sort of pelvic floor issue throughout their lifetime. But from a pelvic therapy standpoint, I think most people at some point, either due to changes in aging, due to changes in their health status, or a stressful event, experience those symptoms, even though they're not reporting it or seeking medical help and attention for it. Because life brings about a lot of changes hormonally, and our musculoskeletal system changes as we age, and that can result in urinary incontinence and those kinds of things as well. So it's bound to happen, and it's all genders. Everyone has a pelvic floor. All of us can experience a slip and a fall or a surgery or things that can impact it at some point. And some of us, myself included, have multiple notches in our little pelvic floor belt,
I
for
can second that.
instance. And
So go
it's
on.
humbling. Yes.
I think it's so cool that you say that. Anytime that I've shared pieces of my pelvic floor journey, which I didn't get help for the challenges I had until 4 years ago. It was during 2020 that I initially found you and was able to find solutions for myself. And when I first started talking to people about this, they were like, what do you mean? What are you doing? Like I went to multiple gynecologists asking for help, and at the time, nobody could really point me in the direction of finding help specifically for my pelvic floor. And I wonder, how many people are listening to this right now. And I think there's more people talking about pelvic floor health, at least from what I'm seeing on my side of social media these days, which is really cool. But it's so interesting because all of these different stressors can impact the pelvic floor. The pelvic floor, though it is a, specific area of the body, are there different things that could be wrong with different aspects of the pelvic floor?
Yes, there's different instances and then different conditions as well. So, endometriosis, for example, a disease process that affects roughly 1 in 10. We know that statistic is climbing up. Speaking to being more alert in the social realm, Amy Schumer has been very transparent about her battles with that. But endometriosis has its own disease process where it's endometrium like cells growing outside of the uterus, not in the uterus, anywhere in that thorax and all the way up into the diaphragm sometimes. But certainly it can embed in the pelvic floor. It can cause guarding because they're experiencing pain elsewhere. So again, with that muscle response of the body tightening to try to protect it. And it can have bowel involvement, which can create issues with bowel movements that can change the dynamic and coordination of the pelvic floor. And then pregnancy and postpartum. So being pregnant requires a lot more of the pelvic floor muscles to support that growing baby. And then depending on how the delivery went, even those that have a C-section can experience changes in the pelvic floor because of the relationship between the abdominals and the pelvic floor muscles themselves, not to mention those who experienced episiotomy or a tear during their delivery if they went the vaginal delivery route. And then injuries, I fell on my bottom from a height of 40 feet, and that annihilated my pelvic
Oh
floor.
my
So you can have
gosh.
one trauma. Have we not talked about that yet?
No, what happened?
We've been friends for like 4 years now. That is how I started my journey in pelvic health. I finished my doctorate degree in physical therapy, specializing in pediatric neurology, and I had a event where I was out in nature camping here in Oregon. It's very beautiful, and all the boys were cliff jumping off of a rock into the water, which was very deep and considered safe. And I did not get the memo that when you cliff jump into the water, you're supposed to land straight. I landed bottom
Oh
first.
my gosh.
I annihilated myself. It was very bad. I'm very lucky because if I'd rotated a little bit more, I'd be gone. At 40 feet, the water behaves very much like cement, which is why you're supposed to lead with your feet, apparently. But I had to go and see a pelvic health colleague who had to fix me up. It was months of pelvic health rehabilitation. And at the end, she said, "You need to quit pediatrics." I was working at the Children's Hospital at the time. "You need to quit peds. You need to do pelvic health. You have the right
Wow.
personality for it. There's not enough." And this was 16 years ago now, 16 years ago. So I went back and recertified, and this is what I do. So blunt force trauma, also a way to
Oh my
inflict pelvic
gosh.
pain. Oh gosh. And then, hormone changes, speaking from those who have a vagina, if we're in a low estrogen state because of stress, as you mentioned, lactating, going through perimenopause or other changes, those can result in changes in our muscle thickness. It can also result in dryness. And then if we're trying to have penetration, that can be a driver of pain as well. So there's a lot of ways to inflict pain on the poor pelvic floor.
I think it's so incredible you say that because I don't know that everybody would just immediately think like, oh yeah, I have an issue with my pelvic floor because this happened. It sounds like there's a lot of things that can impact discomfort in that area of the body. And I'm just really glad we get to talk about it right now. So I'm curious, what are the different types of approaches for treatment of pelvic floor pain?
So, when you come in from a pelvic therapy standpoint, and oftentimes we are working together, especially if someone's had chronic pelvic pain.
Is there a difference between pelvic pain versus chronic pelvic pain, and what is the difference?
Yes, it's duration of time. So, pain being this very broad umbrella category, and under that, different medical diagnoses, because pelvic pain is more of like an umbrella term. Chronic pelvic pain, depending on how it's written up, is sometimes longer than 3 months, and in other cases longer than 6 months. So generally speaking, it's at least 6 months in duration. And a lot of times, because people have gotten a clean bill of health from a provider and said, "I don't know what to tell you," it has been longer because it's taken them that long to get to us from a pelvic therapy standpoint.
So, once they get to somebody like you, what are the different options for treatment?
So we are going to be having a long conversation before we even look at or touch the patient. So oftentimes we're going to be getting a really complete medical history and determining what exactly their goals are, because they could be very different. They could be to be able to sit to do their job. It could be to be able to have intercourse with their partner. So our plan of care is going to be based off not just what we see on our evaluation from what we call an objective standpoint, what we're seeing in their muscles and their tendons and their tissue and their joints. We're also basing it very much on what their individual goal is, because that is going to change their plan of care to meet that unique person's needs and desires. So that's kind of the start of it. And then we are going to look at their posture when they're standing and how they move to get down, because the spine and the hips all attach and are part of the team of the pelvic floor. And then we are looking at things like their scar tissue and how their abdominal muscles are coordinated with their pelvic floor. So then the treatment types, as you touched on, is going to be based off of what coordination patterns we're seeing, the extent of scar tissue, which is manageable, and then also what the unique person in front of us comfort level is. And that will speak to how much internal work and examination we're doing versus external. And a good pelvic therapist is going to have 100 different ways to wrap a present, which means we're going to have a lot of different ways to help the person in front of us, depending on their comfort level. Because if there's a history of sexual trauma and abuse, they may not want an internal exam on the first visit. They may not want it at all ever.
Mm.
And that is okay. And so the point of doing the internal exam is for us to be able to palpate and identify where the tender points are, compare the right and the left and the top and the bottom muscle density, the coordination. It gives us a better picture. However, we have other tools we can use. In some cases, clinics will have a real-time ultrasound. So the same way that you would get it in the ultrasound clinic to maybe look at a baby or look at your organs. A lot of pelvic therapists have that available. And what we use it for is to image your pelvic floor through your abdomen so you can see it, and it becomes a biofeedback tool. So you can actually see what your pelvic floor muscles are doing, and then we provide cues so you can learn how to relax it. And then we will give you different positions and exercises to do that are going to help reset the pelvic floor muscles and give them a chance to let go and relax. I don't call them stretches per se. I call them movements, and they look like very common yoga poses like child's pose, happy baby, deep squat. Then we might be needing to strengthen other parts of the body, including the gluteals that are oftentimes not doing their part in this team. So if the pelvic floor muscles are too tight, a lot of times the glutes are not firing properly. So we want to make sure that they are. And then internally, to address the muscles, we may be utilizing pelvic wands that we make here at Intimate Rose. We may be recommending dilators to help retrain mobility of the vaginal tissue in service of pain-free penetration. They're a cylinder. Ours come in a set of 8. You move from where you're able to tolerate and progress in length and width to whatever your goal is, whether it's to be able to have a pain-free medical exam or to have penetrative intercourse with a partner. So those are used to train both the brain and the pelvic floor and the vaginal tissue. And then we might be working with you on just basic biomechanics, how you're moving throughout your day so that you don't put additional strain on your pelvic floor, how we get in and out of our car, how we get the laundry up off the floor. All of those things are opportunities to ensure that our pelvic floor is getting the support it needs and that it's functioning during our activities of daily living.
Because it's connected to everything else in our bodies. So if something is off, it's going to impact the rest of the chain, including the pelvic floor, right?
100%. Yes. And not even speaking from an egotistical point of view of being a pelvic therapist, but the pelvis is the center of the body's universe. It is at the center of mass, and it is involved with everything that we do because it stabilizes our trunk, and it is a connecting point to our legs. It's very important.
Why do you think it's taken us this long to make pelvic floor health more of a mainstream, given that it's the center? It's the center of our mass. It's the center of our body. This is how we bring life into the world, right? Why has it taken so long?
I think it has taken a very outspoken generation, to be honest, because my professional academy, so as a pelvic health PT, the Academy of Pelvic Health has been around for 44 years now. So physical therapists, people don't know this. We have been doing this professionally in hospitals and clinics for 44 years. But I think that our new generation of millennials and Gen Zs is not having it. And they want solutions, and they've become not afraid of stigma and shame. It still exists, it's still a thing. But these new generations are very outspoken, and they want answers, and they're willing to share to help other people. I had somebody say the other day, and I loved it, is like, if somebody compliments our clothing, as oftentimes as women, we are so quick to say, I got it at such and such. I got it on sale. You should go and get it. And we are so good at sharing information, except for what was private and concerning these sensitive issues. But that's not true anymore. There are whole entire social media accounts dedicated to just vaginismus or just endometriosis. Like, and it is just uncovering all of these all of this new information, and anytime someone gets a solution, they want to share it.
Mm.
So I think that, like, as a whole, the providers have become more outspoken and more in an advocate role for our patients and to other providers to make sure that we are getting involved quicker. And then it's just this demand for answers and for a resolution.
What would life be like if you could get that toned look? You could have physical superhuman strength by training with just 2 kettlebells at home. What would happen if you were on a program that strengthens self-awareness and courage so that you can develop a deeper connection and trust to self? What about this? What if you could be in a community with other women where you are encouraged to be assertive and resilient to build mental and physical strength? If you're waiting to hear what the offer is, this is it. Swing to Snatch, a 13-week kettlebell intensive, is my signature course that empowers women to get started with kettlebells. Work with me live in a virtual container guaranteed to grant you kettlebell queen status. To learn more, visit www.colleenconlon.com. What a great time to be alive from this point of view. Seriously. I can't imagine the amount of people who had to go through all of this pain in the past, what life could have been like if we had solutions like the current generation is able to provide today.
A lot of people suffered prior.
One of my favorite components of pelvic floor physical therapy that you touched on that has really been transformative in regards to working out, stress management, and sexual intimacy has been working with the ultrasound and understanding what it actually means to drop the pelvic floor. Being able to see that and feel that simultaneously was so big and helpful for me. When I initially went to pelvic floor PT, I didn't know anybody else at the time who had even heard of that within my circle of friends. And I remember being really nervous in the beginning because I didn't know what to expect. And I was really fortunate. My pelvic floor PT, I met with like 3 different therapists, and I ended up sticking with the one that I felt most comfortable with. And I think our first session, we did internal work for like 15 minutes. And, it was a great experience. I stuck with her for about 3 months, multiple times a week. And then I left where I lived. And that's when I started to use all of the tools from you. And it was just so great. But to somebody who has never, heard of this, somebody who's like, what do you mean somebody's going to be inside of me massaging muscles for X amount of time? I feel like it can sound a little strange. Yes. So can you elaborate a little bit more on like what is normal if you're going to work with a pelvic floor PT, they're going to be internal. What are normal expectations of a good session?
Absolutely. So before we have done the internal work, as I mentioned, we would have done our full screen and we would have talked together, and all of that bonds us, and it helps us for the patient to get trust and to get a sense of what's going to happen. It also gives us the chance to answer any questions that they have. Once we start that internal process, it's like a pilot's checklist in our brain as a therapist of the things that we are specifically looking for anatomically and the things that we are assessing in terms of how the muscles are behaving. So very much like if you've ever injured another part of your body, like your ankle or your shoulder, we're checking range of motion. We're saying, push against my hand here. Those kinds of things are happening during the internal assessment. So within the pelvic floor, it's a bunch of different muscles. So we talk about them collectively as the pelvic floor muscles, but there's several different muscles in there and they all have different functions. And that's where we want to assess exactly which muscles are needing help, which are doing well, and where we can have improvement, maybe in strength or mobility or coordination or all of the above. So once we get inside, we are systematically palpating. So we're touching with one finger. We don't use the speculum. We are going around what we call the pelvic clock, and we're asking, is this tender? Is this tender? We're going to ask you if you can tell if we're on the right or the left. Sometimes when people have been in pain for a very long time, their brain stops being able to interpret signals coming from the pelvic floor, which can also be disruptive in how the pelvic floor muscles are coordinated. So that gives us information too about how your brain and your pelvic floor are communicating. I liken it to when people have been in pain a long time, sometimes the brain is speaking English and the pelvic floor is speaking French. It's like we are not communicating, we're not getting along. So we're assessing that. We're looking for scar tissue, and then we're going to ask you to contract the pelvic floor muscles as strong as you can, and we're grading your strength. And then we ask you to relax. We ask you to drop and relax the pelvic floor in a gentle bulge. We're looking to see if you can. We're looking to see if the pelvic floor muscles have extensibility. And then
My
we'll ask,
first time I was a mess. I like couldn't do it. I was like, what is she asking me to
yeah,
do? What's going on?
yes, as if she's speaking French. Yeah. Yes. And for people that have that chronic tension, that's all they know. All they know is this tight uplifted spot. Whereas there's this wide range, almost like a trampoline. We need to have that flexibility, as I mentioned, for bowel movements and urinating properly and allowing for something to come in. But if the pelvic floor muscles don't have that, that's can be a driver. And we definitely work to retrain, almost like teaching you how to drive a stick shift, when to relax, when to contract. All of those things are what we're assessing internally. And then to the manual therapy part, and hopefully you'll attest to this as well, this is not a no pain, no gain kind of physical therapy. This is not if you've ever torn your ACL and had a physical therapist really need to achieve extension on the first day and they're pushing on you and it's uncomfortable. This is not that. We have very, very gentle techniques where oftentimes we're just pinning the muscle with one finger and moving your leg into a certain position, and we hold and pause for a minute or two. Positional release or strain counter strain is another name. It's a very powerful tool. I would say that's my number one manual tool. They may also do some gentle elongation technique. When they're doing this, they're not going anywhere near the clitoris. So it's not, this is, if people are wondering, like, is this like a sexual thing? What is happening? This sounds really uncomfortable, as you touched on. We are staying within the muscle belly. And so that it's nothing to that effect. And most people that are experiencing pain are experiencing so much relief even within 1 to 2 sessions. It can be very, very powerful. So we want to decrease the pain. We want to improve the muscle function. And then we go about retraining those coordination patterns, especially if you've been walking around clenched for a long period of time.
It's so cool how something that's relatively simple can make such a dramatic impact on somebody's life. Can you tell us a little bit about the tools at Intimate Rose? Oh,
Yes.
you've already talked about the dilators. We haven't really touched on the wand. I would love it if we could really take some time to talk about this wand. So, anybody who's listening, my experience, I had chronic pelvic pain. I went to see I went to a pelvic health rehab center, And then we did a number of injections. And then they sent me off to pelvic floor PT. And then my pelvic floor PT introduced me to the Intimate Rose wand, which Amanda created. And it has just been one of the best tools that I use on a weekly basis. I take one day a week where it's just recovery day, no working out, and I get massage and I work on my pelvic floor with my wand. And it has really been a game changer for managing my chronic pelvic pain. So can you tell us about this tool?
Oh, absolutely. And I'm so happy to hear that it's helped you so much. The wand, we have 4 wands now. They are all the exact same shape and size. I specifically created it to be able to reach different aspects of the pelvic floor. And the point of the wand is to empower people to be able to reach tender points and areas of restriction independently. So it's an extension of therapy, but it's something that you can always use as your own tool to bring down your own pain for as long as you need it. So it looks kind of like a question mark, and it's covered in medical grade silicone that's really soft and really smooth. The 4 different types reflect the different types of wand it is. And these are beneficial for people who have different needs and different desires in terms of comfort. So the purple wand is our original wand. And then we have 2 vibrating wands that are the same but different colors. They are turquoise and blue. The blue is for people who like blue. we we had men, because men use our product as well, and we had a lot of men write in and say, I really love this wand, but please, could you make something that looks a little more manly? And interestingly enough, like blue is one of my favorite colors. So there's a ton of women buying the blue. It's for all the people. It's
I
for
have the
people who
blue
like blue.
too.
Yeah, it's so pretty. It's like the prettiest blue too. But it's got 10 different frequencies of vibration. Some are very soft and some are a little bit more strong, and some of them kind of fluctuate in and out. Vibration helps introduce blood flow to the area, and it's very soothing. This one has been, above all, a massive game changer for people who have pain, and especially those who have chronic pain. We've gotten so many different letters from all over the world saying it's the first thing that's ever worked for them,
Wow.
which is really humbling. But either end of that wand can be used vaginally or rectally to address different aspects of the pelvic floor. And it is patented. It's the only type of device that can reach a very specific muscle called obturator internus, which lives on the sidewall of the pelvis and connects to the hip. And that's where, I didn't touch on this earlier, but that muscle is reachable through the vaginal canal or the rectum, and is a member of the pelvic floor, but it's also a card carrying member of the hip category. It's a hip rotator. And if that is tight or painful or not working properly, it can feel like hip pain. And that's where some people can be, living with chronic, what they feel like is hip pain, but they can't reach it. They can't stretch it. They've been, tackling their poor piriformis who had nothing to do with it. And it's not working. It shares a fascial plane. They back up to each other, and that's where the wand is able to reach in and hook. And then it's also able to come under the bladder. So for people who have adhesions around their bladder, those with painful bladder syndrome, or just areas of restriction, for men who have had prostate cancer and had surgery to remove the prostate and have a ton of scar tissue, it's great for that. And then the last wand is our yellow one. It's a temperature therapy wand. It can hold cold or heat. It can be placed in the freezer. There are some people, I'm not one of them, but there are some people that respond very well to ice packs and to cold packs, and they have chronic inflammatory diseases such as endometriosis, or they're post-operative. And that cold popsicle-like feeling of the wand is a total game changer for them, and they love it. For
Wow.
those of us who like heat, it can be run under hot water and it will retain warmth, and it can be just a nice, almost like a hot pack to the pelvic floor. And then we have another wand in the works. It's not yet out. It's been in development for quite some time, but it's going to have some mobility capabilities. It will be ideal
Wow.
for people who have different types of anatomy, who are trying to reach better, or those who are pregnant, trying to reach over baby. So stay tuned. That one's on its way.
That is so cool. So amazing. All these different types. And I love that you explain why we are potentially using these different types. I remember, and I'm curious if you can touch on this, Amanda. When I first started showing my Intimate Rose products on my social media page, a lot of people started asking me, like, are these sex toys? And even calling, you have a wand, we have the pelvic floor wand, but then there's also like a wand, like a G-spot wand. And not to confuse the two, what happened? What do you say to people when they ask, like, oh, are these sex toys?
I always say these are tools, not toys, and they are created to help very sensitive pelvic health issues for all different types of people. I will say the caveat to that is that, especially with those who do have a goal of resuming sexual activity, that my tools can be used as toys once the body is ready and once the person is ready in what I call off-label use. Because most certainly that vibrating wand can be placed in or around the clitoris and can be used for pleasure, and that is okay. And I am okay with it. And cheers.
I love that. We love a healthy pelvic floor. We love a healthy sex life. You do you. No shame.
And
Uh,
both of those are part of being a person.
exactly. For somebody who, maybe they feel a little intimidated to go to a pelvic floor PT, what do you advise as the professional? Can they get started with the tools on their own, or would you advise somebody meet with a pelvic floor PT first and then graduate to tools on their own?
Absolutely. I am deeply empathetic that there are a lot of barriers to getting to see a pelvic health therapist. And one could be not feeling emotionally ready, two could be finances, insurance reasons, and three could be distance and proximity to a great one. So, most certainly, we try to foster and take care of each and every person. They can buy direct off of our website. Every product comes with a guide. I have hundreds of free resources on our website. I mean, everything on our website is
Great
free, but
resources.
oh, thank you. We are always, anytime I get a new customer service question, I'm making a video to try to help other people. Because if one person has that question, other people have it, they just didn't write in. So hundreds of videos and guides on body position changes, if this, then that, introductions, all of these things. And then my customer service team is incredible. They are answering them. I'm answering the emails as well. And then from a pelvic therapist standpoint, I will say we are really different as providers. We spend a lot of time with you. Most of us are spending an hour one on one. We are in all different clinical settings to match different comfort levels. We're in hospitals, we're in private practice, we're in concierge, we're in home health. There are a number of us that are accepting every insurance under the sun and some that are doing cash pay. If you go and you have your first evaluation and it's not a good personality match, as you touched on, you met with three. I'm so glad that you did, because we are, as a whole, really caring, empathetic people. But as providers, we're all different people. And so is everybody else, all different people. So finding that match is really important. And so I would say that we're really nice people. Give us a chance. And we just want to take care of you. And if it's not a great match, there are others who are going to hear you out and we're going to help you reach your goals.
Thank you so much for saying all of that. I think this is a very vulnerable space for most people. So to get to hear all of your warmth and kindness on this topic is really lovely. Thank you.
Absolutely. I would say most of us have been the patient on the table. A
Mm,
lot of people are not going to get a doctorate in physical therapy to specialize in pelvic health without having had their own experience with it, and that changes us.
I was gonna ask, like, what type of a person wants to go into pelvic floor PT?
Those who have had it
Yeah.
themselves.
Okay.
Yes.
I have one final question for you. Do you have any last words to help somebody who might need a little extra confidence to take the next steps to empowering themselves with this piece of their journey?
Absolutely. I would say whatever it is that you're experiencing and living with, it's not in your head. Your brain and your body are telling you something, and you don't have to live with this. And it is super fixable. It may take time, but it's fixable and it's totally worth it to get your life back or whatever activity back that you're missing out on, and to be able to live comfortably and to do all the things that you want to do.
And where can somebody reach out to you if they have a question for you directly?
They can reach out in a number of ways. On Instagram, we answer our DMs. It's at Intimate Rose. My personal professional account is A Olson DPT, and then you can email our team at support@intimaterose.com, and we can help find whatever solution you're looking for, answer questions about the products, and get you connected with a pelvic PT in your area based on your zip code. So that's another service that we offer as well.
Thank you so much for being here today, Amanda.
Thank you so much for having me.
Thank you for listening to the Dangerous Women podcast. If you had any groundbreaking takeaways from today's episode, please tag us on social at the Dangerous Women podcast. To make sure you never miss an episode, subscribe below.